just not only healthy and safe, but staying sane. We know these are challenging times, and we are really glad to be able to be with you today. We are thankful again, still always, for this technology that has helped to bring us together over and over and over. It has been just as beneficial, honestly, to us as it has been, as we're hearing, it has been for you all. And we are very grateful that you have made us a part of your week and your month. And we're really very proud of each of you and of the IIAV community as a whole. You've just shown tremendous resilience and have done such amazing things to serve your teams and to serve your clients. And we are just quite honored to serve you and your teams in turn. We remain committed to walking with you every single step of the way through COVID and beyond. This certainly will not end with COVID, but we know that this is a particularly challenging time, and we're with you. We see our team as an extension of your own, and we certainly hope that you will let us know if there are additional ways that we can support you. We're happy to do that. Again, we are very happy to be with each of you today, and we invite you to share your webcams. Seeing faces makes such a difference, especially right now, and we really would like for you to be able to see each other. Many of you have already done this, and I thank you for that. For those of you who have not, it's optional, but if you're comfortable doing so, or if you want to take a step out of your comfort zone, try something new, I invite you to do that. I encourage you also to make sure that your name badge tells us who you are. I compare it to, walking into, a cocktail party or a meeting and having the wrong name on your badge. You don't want to do that. So I'll use myself as an example. If you look at my video, you'll see my first and my last name, as well as my organization. So it says Carter Lyons IIAV. If you would like to add or edit your own name, you just need to hover your own video where it shows your video on the screen, and you'll see a blue box appear. It has 3 white dots, and then if you just click that box, you'll see a rename option. You select rename, and then you can update your name as you wish. I also would like to take a moment again to thank our 2020 IIAV partners. To say that they are our loyal supporters would be a tremendous understatement. They signed on to partner with us in the beginning of 2020, and little did we know how much we would really need them. We knew they were going to be valuable partners, but they have just been unbelievably supportive, and we are so grateful to them because that has enabled us to then turn around and serve you all. So we would very much like for you to please take a look at the names of those companies on your screen right now. They have stood by IIAV, and as a result, they have stood by you, each of you, and they have enabled us to do things that we couldn't have done otherwise. So we express our deepest gratitude to each of them, and we hope that you will please take notice of those organizations and please extend your own thanks to the individuals that you work with that are associated with each of these companies, because a thank you goes a very long way, and we just cannot thank them enough. And so now for today's conversation, we are very, very fortunate to have Kim Daniel joining us today. Kim is an HR attorney with the law firm of Hancock Daniel. And as many of you know, last Monday, July 27th, Virginia's new workplace safety standards took effect. And not only are they new to Virginia, but we are the first state in the nation to have something like this in effect. And so as a result, we are all pivoting yet again, and has left us with a lot of questions. And so we brought in Kim. She is here to help us navigate what these standards mean for us, not only as organizations, but as individuals who work within organizations. And so I know that today is going to be an incredibly informative conversation. I encourage you to take notes. I encourage you to interact in the chat. And as a reminder, we are recording this. So I suspect this may be a conversation that you'll want to go back and revisit later for just like, what did she say about that? I have a feeling that that recording is going to come in handy. So Kim, thank you so much for being with us today.
I'm glad to be here and glad to answer questions as we go along. I'll try to look at the chat. I'm not great at talking and reading at the same time.
I got you. It's all good.
Great. And I do have slides that we're going to share on the screen in a minute. You're welcome to have a copy. I'm sure Carter can just distribute those or make them available. And there are actually a lot of resources. Fortunately, they're available on the Virginia Department of Labor and Industry website as well. So I have more slides than we can cover, but we'll get through them and try to answer as many questions as we can. And also feel free to contact me afterwards if I can help with specific questions. So the unique legislative tool that was used in Virginia to pass these new standards was called an emergency temporary standard. If you look at it, it looks a lot like a regulation, any other regulation you would read. And Rebecca, are the slides up and I can't see them, or there we go. Okay, we can go to the next screen. Or maybe I can advance them. There we go. Great. So you'll see at the heading, it's 16 Virginia Administrative Code, section 25 and subsection 220. And there are about 10 different categories that we'll go through. The first question that came up, and it took them days to get these things passed, long days, was why do we need them really? Don't we have the CDC guidelines? Don't we have OSHA? And what became very clear over time was that OSHA's guidelines are very general. We've not been through a similar viral pandemic. And so they weren't specifically designed really, or weren't adequate to keep people safe. And the CDC guidelines, while much more specific, are guidelines. And so for those employers who were acting in good faith, that was terrific. For those employers who had other priorities or just found it infeasible, they had the option not to follow those guidelines. And there was enough concern about employee safety that the governor of Virginia passed an executive order telling the Department of Labor and Industry to develop these standards. They are designed, as you would expect, to control, prevent, and mitigate the spread of SARS-CoV-2, which is the disease that causes COVID. And they apply literally to every employer and employee in the Commonwealth of Virginia. So big, small, there was an argument to sort of exempt smaller employers, and that failed. I will say these are temporary, and so there is an effort underway to make them permanent. They are taking comments right now. So if, as we go along, you hear things and think, okay, well, I can live with this because I have to for 6 months, but in the long run, this is not how the law should work. Now is the time to be submitting comments because they're taking them for the next couple of weeks on the potential permanent standard. So we definitely have these for 6 months unless the virus goes away or we have a really quick vaccination process. But after that, it's still up in the air as to what the final standards will be. The focus, as you can see from the box on the right, is how do you assess your workplace risk? And that will vary by employee, and that will vary by the tasks that each employee perform. But the 4 categories are very high, high, medium, and lower. Next slide, please. So these are sort of common sense, I think, of how any of us, having lived with COVID now for a couple months, would assess risk in the workplace. But there's a multi-factor test. There's no single factor that controls. And you look at all of these variables. Some of them do seem to have more weight than others, at least for me. I think outdoor environments, although pretty rare, I suspect most of you don't work in offices that are outdoor, obviously provide some nice benefits in terms of airflow and easier physical distancing and things that really reduce risk that otherwise might exist. And I think that's why we've seen things like restaurants trying to shift outdoors and other facilities that have that space trying to use that option. Some of these things are more manageable than others. Some of your businesses or the businesses that you work with are going to necessarily require interaction with potential virus exposure because it requires interaction with other human beings. So it's a good list to keep in mind when you are required to assess the risk for each of your employees. and you don't have to literally make a check mark for each of these factors, but documenting in a written document that you considered each of these for each employee that you categorized is important. Next slide, please. In addition to the other factors, these are also on the list. If you have folks who have to share transportation for work, that obviously increases risk. Contact with contaminated surfaces was a big concern in the beginning, less of a concern now, but not a zero concern. And also airborne transmission, which I think has actually become more of a concern as time has gone on. Next slide, please. There was a lot of argument, again, as I mentioned, over why do we need these? Don't we have the CDC guidelines? And what resulted from that discussion was part of the regulation that says if you actually comply with the CDC guideline and it is equivalent to these new Department of Labor standards, then you can document which guideline you're complying with. It has to be the most recent one. And you have to be able to point OSHA to that guideline. They're not going to go look for it. You need to have it handy. But if you can show them that you're complying with a guideline instead of one of these standards, that counts as compliance. And just to step back, how any of these standards are going to be relevant to you other than doing things to keep yourself safe and your employees safe is if an employee feels unsafe, they can call, they can fax, they can text the Department of Labor and Industry, basically call OSHA and make a complaint that they feel unsafe. And you'll end up with a workplace investigation from the Virginia OSHA people, Bosch, just like you would have on any other workplace safety issue. So now you're going to have potential fines for noncompliance and potential required postings and potential remedial actions. And that's really why, in addition to all the good reasons and noble reasons that we all want to stay safe and healthy, we also want to avoid Bosch and a Bosch investigation. Someone have a question? Not yet. Okay. Okay, next slide, please. In addition to actually complying with a CDC guideline that's equivalent, even if you so in addition to an equivalent CDC guideline, if there's a CDC guideline that's not equivalent, but you have relied on it and tried to comply by following it, Bosch is going to give you credit in terms of saying you get some good faith, which reduces the penalties and may reduce any action that's taken against you for a failure to comply. So that's good. Again, this is somewhat of a documentation exercise, so being sure that you are keeping good track of here's the standards we were trying to follow, and having this available to show to an investigator will serve you well. Next slide, please. You are not required as an employer to do contact tracing. There was a lot of concern about that, and while there are notice requirements in here as to who you have to tell if you have a case at work, you do not have to contact trace, so don't have to worry about that. Although I think the governor's going to announce an app today and encourage everyone to use it. So you could do that, but that's optional and separate from the standard. Next slide, please. There was a lot, it took sort of an extra month for these things to go into effect, but they were effective upon publication in a newspaper. Again, they remain in effect for 6 months unless the state of emergency ends before that, or a permanent standard is passed before then. Probably won't be passed before then, might be passed upon expiration. Or if the Health and Safety Code Board decided that the standard was not a good idea. Again, I don't see that happening. A lot of work went into it. Next slide, please. So the 4 main requirements really are that you categorize all your employees, that you implement all the necessary safety measures. If you're big enough or you have high enough risk employees, that you create an infectious response plan, and that you provide training. Those are the 4 big things that you need to do. There's 2 different types of training that you have to do. for employers who have at least 11 employees and have at least one of those employees who's categorized as a medium risk, they are the group, so it's most employers, who have to prepare this infectious disease preparedness and response plan. And that plan has to be prepared within 60 days of July 27th. Employees also have to be trained on that plan within 60 days. So you can't wait till the 60th day to get your plan together, because it would be hard to get the plan together and train all on the last day. Probably want to give yourself a little more breathing room. For other employers, so smaller employers, you don't have to prepare this plan, nor do you have to train on it, but there are some minimal training requirements. There are sample materials on the Department of Labor website. It's like a 3-page document, really, that you can simply make available to your employees, and you have 30 days from July 27th to do that training. So pretty easy. The Department of Labor really has tried to make it easy. Okay, next slide, please. There's a whole lot of definitions that we'll go through, and I'm going to try to go through these pretty quickly, but you'll see them come up when we get to the point of reviewing what is required of all employers. The first one is administrative controls, and there are several types of once you've categorized your employees, then you have to use different types of tools to reduce risk. Administrative controls are one of those tools, and that's really adopting a policy or a procedure to limit risk. Use of PPE by itself is not an administrative control. This does not mean you should not use PPE. PPE is required all throughout this standard, but you cannot simply make masks available to your employees and say, oh, now we have no more risk, right? So they require it and encourage it, but say it's not enough by itself. There's been so much science that we all have learned or should be learning. There was a lot of discussion, as you would expect, over who is known to have COVID, who is suspected to have COVID, and what does it mean to have symptoms of COVID, because there are so many carriers who walk around without ever knowing they have it. So they felt the need to define asymptomatic. Asymptomatic is a person who does not have symptoms. Okay, I think we might have figured that out without that definition. Next slide.
Kim, we had a couple of questions come in,
okay.
So I wanted to just interject for a second.
Absolutely.
The first question that we received was around, is the training and preparedness only for employers with 11 employees and 1 at medium risk?
So the answer is, if you have at least employee 11 and you have at least 1 medium risk employee, you do have to do the plan and that higher level of training. If you have any very high or high employees, you also have to do the training. So if you have 1 very high employee, you have to do the training, the higher level of training and the plan. It's just that, frankly, most of you all and most of the folks you work with are going to be medium or lower, because, and we'll get to this, I'm sort of skipping ahead, but very high and high are effectively healthcare employers who are dealing with known or suspected cases of COVID. So they know the people that they are doing healthcare procedures on either affirmatively have tested positive for COVID, or they have symptoms and they don't have another diagnosis. So as likely as not that they have COVID. For most other businesses, even other healthcare providers, if you are trying to make an appointment with your doctor or your dentist, most of them are doing screening and saying, yeah, don't come in if you have any of these symptoms. If you have a fever, if you have a loss of taste or smell, right? So those folks are not dealing with known or suspected cases of COVID. Any of us might have it, but if you don't have any symptoms and you don't have a positive diagnosis, you are not known or suspected. So that puts most of us into the medium or lower category.
The next question was, in terms of the response plans, do any templates exist?
Yes, and they are on the Department of Labor website. They are really long also, but great. And it's health.virginia.gov. You have to sort of fish around on the website. It doesn't pop right up. The way that I usually get to it is they have a news or press release about these new standards. And then in that press release section, they also have another link to their COVID resources. And when you go to their COVID resources, they have in Word format, so it's easy to copy and paste and customize the training materials. You'll see, I just took these off their website. I shortened them. They were even longer. But they have the training materials. They have the lower risk training materials. They have a template plan. They have 9 steps for employers to comply. So they have a ton of resources that make it thankfully easy. And it's because they gave us such a short amount of time to comply. They knew employers couldn't do it otherwise.
And I will find that link and I'll put it in the chat and make sure we get it out to everybody with the evaluation after this. One more question before you move on about who will be regulating this besides the Department of Health. Is it just the Department of Health, or are there other people regulating as well?
It is the Department of Labor and Industry, and it is the Occupational Health and Safety branch of the Department of Labor and Industry called VOSH, VOSH. And you know that you have a VOSH complaint because they fax you, they email you, they call you. So they are in charge of workplace safety.
Okay, thank you. That was the last one for now.
Great. COVID-19, we all know what that means. Disinfecting just means that the cleaning supplies you'll see we're required to provide in the workplace have to meet EPA standards. There is literally like a 60-page document on the website. Also easily available if you want to check if your cleaning products meet these standards. I think probably most of the ones we've all been trying to get or trying to use do, but good to know that you have a resource to check if you need to. Next slide, please. The regulations or standard, as you'll see, talk a lot about the duration and frequency of employee exposure. Because obviously if employees are exposed for a longer period of time or more often, that increases the risk. The definitions include an example of acute situations versus chronic situations, and either can increase risk for employees. But again, this all goes to evaluating which risk category you're going to put your employees in. Helpful definition when you're doing that process. Next slide, please. Economic feasibility is important because, again, when we look at the requirements that all employers are required to put in place to keep the workplace safe, there is an economic feasibility component. The Department of Labor and Industry realizes that this is an expensive and challenging financial time for a lot of folks. And so it says that you can consider cost if it is a true financially unable to undertake the measures necessary situation. It does note though, and this is interesting because you rarely see this in a regulation, that if the industry standard has been effectively to spend the money needed to comply with the standard, then the fact that you personally don't feel like you can spend the money is not going to be a valid legal defense. So what your peers are doing and knowing that and keeping in touch with each other is important. You know, one of the biggest workplace changes I've seen sort of in the blink of an eye was the installation of these screen barriers everywhere. In the grocery store and the pharmacy, most businesses that you walk into now have additional protections like that. So if you were concluding, it would keep my people safer, but it's too expensive, and all of your peers have undertaken that expense, again, it's going to be challenging for you to win on that type of defense if you get an OSHA complaint. Next slide, please. An employee is everyone. It's temporary employees, it's part-time employees, it's people that you contract with. So just a very broad definition of who's covered, who has to be protected. Engineering control is another type of protective measure, just like administrative control was that we talked about earlier. Engineering controls really are applicable, again, to very high or high-risk health situations, and they require different types of ventilation systems to help minimize risk for COVID. Not something that the typical office is going to have to worry about. Next slide, please. Exposure level is all the factors that we've talked about and the categories that we've talked about that you already know by heart. Next slide, please. Again, very high is for folks who are either handling laboratory samples or doing specific medical postmortem or other lab procedures on folks who either have been diagnosed with or are suspected to be infected with the virus. And those procedures are aerosol generating procedures, collecting or handling specimens, or performing an autopsy. So none of y'all, I presume. Next slide, please.
Kim, we did have one question, and
Sure.
it was posted in the chat. It's about the specific document for the employer guide.
Okay.
Is it safe to assume that if it's on the DOLI's website and it's listed as the employer guide, is that the document you were referring to, or should we follow up with you later on that? And I know you can't see the chat right now. That's why I'm asking it this way.
So I can see the slide.
Okay.
Let me look really quickly. Well, I think I can see the slide. Ah. I can't see the slide. That was a lie.
Okay. It's okay.
I'm glad to confirm.
Yeah, I'll circle back to you with it,
Okay.
and then we'll get back to you with that answer, okay?
Great. High risk, similarly, are jobs or job tasks that require employees to be inside, so less than 6 feet between them and another person who is known or suspected to be infected with the virus. Next slide. They include a lot of examples of these situations. Not surprisingly, most of them are healthcare or healthcare related. But just because you are in one of these businesses doesn't mean necessarily that you're in the high risk, because again, it depends on whether you're providing care to people who are known or suspected to be infected. Very much depends on their screening and other policies. Okay, next slide. Medium, it's just the first one that's probably applicable at all to you all, is risks or job tasks that are not very high or high, which makes sense, and that require more than minimal contact inside of 6 feet with other employees or other persons or the general public who may be infected, but are not known to be or suspected to be infected. So I think really if you have any employees who are more than very minimally required to interact with others, any type of others, inside of 6 feet, probably you're in the medium category. Some examples are on the next slide. Big group of folks here, right? And it's interesting because I just point out that last example, you know, I'm personally pretty anxious about flying or being on public transportation, but that's a medium risk under these categories. It's not a very high or high. So obviously these are standards that are created for a very specific purpose. They're not necessarily your personal feeling of risk, nor will they be an employee's personal feeling of risk, right? Like that is why the education is important, because there's been a lot of publicity about them and people may expect that certain things are now mandated by law or required, which may not actually be true. And you could be working in any of these same settings, right? A retail store, a package store, a vet, personal care, such as a salon. If you're not required to be within 6 feet of another person, you're still going to be in the lower category. You're not going to be in the medium category. So obviously this means, if you take the hair salon example, somebody who's cutting your hair is going to be within 6 feet. But the receptionist may never be within 6 feet of folks. So the categories for employees is going to vary much, very much, even within businesses. It's not everyone in the business who will have the same categorization in all likelihood.
And we had a question come in and it says, what if an employee visits a known area that is now considered high risk? Does the organization have an obligation as it relates to requiring a 14-day self-quarantine?
So because that Hmm. Interesting. My first response was going to be that because that was not part of their job, that it is a risk and you need to address it, but you would address it outside of these regulations. I suppose there are still people who are required to travel for work, right? And one of the requirements of these regulations is that you have policies and you have flexible sick leave time. And so it depends on the type of exposure, but currently in Virginia, there is no executive order or regulation or law that requires that you quarantine after, for example, going to Miami, Florida, pretty high risk area. If you lived in New York or some of the other states, particularly in the Northeast, there is that requirement. I think even DC might have that requirement now. So very much depends where you are. But if you're a Virginia employer and you know that employees have traveled to high risk areas, you can adopt a policy that requires that folks quarantine. But this emergency temporary standard doesn't mandate it. And then you get into interesting questions about, do you pay them for that time? And does sick leave apply for that time? And does the Families First Coronavirus Relief Act apply to that time? So there's lots of related questions that go with that policy, but right now in Virginia, that policy would be optional and not mandatory.
So she just added to her comment, she just said that she was specifically referring to non-work travel and in general for any employment. But
right.
Thank you for all that additional detail, Kim. No, that was good. It was really good.
You get me talking. Okay. Lower risks, which is actually a huge percentage of Virginia employers, are those jobs or risks that are not in any of the other three categories, and they do not require contact within 6 feet or inside 6 feet of people known or suspected, or who may be infected with SARS-CoV-2. So effectively, if your folks don't have to interact with others within 6 feet, or you can adopt safety measures that we've just talked about, masks, plastic shields, remote work, all the measures that we'll talk about that are available. Your people are going to be in a lower risk category. You're going to have to do minimal training, and the burden on you don't have to prepare a plan. The burden is pretty reasonable. Next slide, please. Sorry. Measures that help you achieve minimal occupational contact. So these are, again, the safety measures that even if you have a medium risk person, you can reduce them to lower based on how many of these things you can adopt to keep people safe and to keep them from having to interact with other humans within 6 feet. Floor to ceiling physical barriers constructed of impermeable materials. So these are the sneeze guards that we see everywhere that we've talked about. Telecommuting, staggered work shifts, delivering services remotely by all the various means that we all use to do work these days. Next slide. Mandatory physically distancing while people are in the workplace, employee use of face coverings. Again, they put this limitation in there a couple times saying, just because you have on a mask doesn't mean you can ignore all these others. But if you have to be closer than 6 feet to someone, you have to have on a mask. Your folks, this is the only place that may be required inside of your offices, because if you are in a private office, the executive order from the governor to date does not require use of face mask if you're not interacting with the general public. So long as you can keep people more than 6 feet away, you're still not going to have to require face mask use inside of your office, but that distance is important. And if you have somebody who's particularly nervous, has a health condition, living with an elderly relative, all these risk factors that we're so familiar with now, you're going to want to be sure that you have made face masks available and that you've clearly communicated that these are the rules so people understand. Take them seriously. Next slide, please.
I have one question that just came in.
Great.
It says, what if you have a business with a very large commercial building with different tenants on each floor, and you find out someone several floors down has tested positive, meaning you possibly shared an elevator with them and you were within 6 feet?
It's probably happened to a lot of us. So with this standard, for the first time, the landlord is required to have notice that people in the building have tested positive and required to let others know. So that's how you might have gotten that information anyway because of word of mouth, but now you should know, or your employer should know when that happens. And ideally, the occupancy in an elevator should be sufficiently limited so that your risk of exposure is low. It's a short amount of time and you can be physically separated from a person in the elevator. But there are going to be people who test positive after having been in the workplace and after having been in an elevator. So all you can do is what we all are doing, which is self-monitoring and complying with policies as best we can to stay safe and healthy. I hope that answered the question. They defined face covering just because there's been a lot of focus on face masks and facial coverings. Really, the long and short of it is people can use whichever type of face covering that they wish to. Unless you're a healthcare provider, you don't have to worry about having an N95 or meeting surgical grade standards, right? Any type of covering that actually covers your nose and mouth. That appears to be the challenge. Not just your chin, not just your mouth, covers your nose and mouth, works as a face covering. Next slide. Hand sanitizer needs to be at least 60% alcohol. I've seen a lot of them with more than that, but that's your standard if you're looking to buy hand sanitizer for the office. Next slide. Again, here's the definition of known to be infected, whether you have symptoms or not. If you've tested positive, you're known to be infected. You may be infected means any human who hasn't been vaccinated, basically. Next slide. I didn't include this just to back up, but both the CDC and the Department of Labor and Industry have come out and said the antibody tests aren't reliable. So if you have an employee who comes to you and says, I don't need to wear masks, I'm exempt from all of this, I have tested positive and I have antibodies already, there is no exception in the regulation because they don't give any credence scientifically yet to the antibody tests. So that doesn't make a difference. There is a definition in these regs about PPE. And again, if you're in the healthcare field, the specific standards that you have to meet are very important. For your purposes, a lot of employers are making masks and gloves available. I'm not sure gloves even, cleaning seems to be much more important than the availability of gloves. And I don't know of any employers outside of healthcare who are providing gowns. So whatever you can find that works. I mean, Amazon has masks now. Masks are not that hard to find anymore. Probably works to meet the PPE requirements in the typical office environment. Next slide. There's been, sorry.
It's okay. We had a question that came in. Can employers mandate the use of the new COVID-Wise app?
Sure. How's that for a short, easy answer?
I was gonna say that was a yes.
There understandably is appropriate concern for confidentiality of medical information. And so there was a lot of discussion in the beginning of, can you take people's temperatures? Can you require that people report a positive COVID result? Due to the danger to other people, the EEOC has come out and clearly said, yes, you can require people to submit to these screenings basically to ensure they're healthy before they come into the workplace. And you can absolutely require that they share medical information with you related to COVID. Usually the rule for employers is that you can only request and even receive information that's job related. But COVID impacts everyone, and it's so highly contagious that it's really the most expansive or permissive standard I've ever seen for medical information. And so mandating that, first of all, employers can make all sorts of rules because employment is optional. People can choose to work at your location or not, depending on if they agree with your policies or not. The app, I'm not sure, will give anyone other than the Department of Health in Virginia information about where you've been. I don't think any information will go to the employer. So you're really doing it as a public service or a public good to help minimize the spread throughout Virginia. It's not even going to give the Virginia employer any additional information specific to their employees, but they could, and they do, and they have to under these regulations, require employees to let them know if they're sick or if they've tested positive for COVID. So the app is really not even that much of a confidentiality issue compared to what's already required of employees. So I'm never that short. Physical distancing is just 6 feet of separation, right? There was a lot of debate about whether if you were exactly 6 feet, did that meet the requirement? Did you have to be less than 6 feet? And they came down and said, yes, have to be less than 6 feet. So if you're at exactly 6 feet apart, that works. You've met the requirement. Next slide, please. We know what SARS-CoV-2 is, signs of COVID, and this has just evolved. It seems like this list keeps getting longer and longer and longer. At the time the regs were passed, it included all of these different symptoms, but I've seen actually a good number more currently on the CDC website. So we just keep getting more information, which is good, but sort of also constantly confusing. Next slide, please. Again, the types of masks, you don't have to worry about meeting a specific standard so long as people have covered their face and their nose. Next slide, please. Suspected, we talked about, means you have signs or symptoms of COVID, but you haven't tested positive yet. And there's also no alternative diagnosis. So if, for example, you had signs or symptoms of COVID, but you had tested positive for the flu affirmatively, then you would not be suspected to have SARS-CoV-2. That's the only likely exception I can think of right now. Symptomatic means you're actually feeling sick. And right now they're saying symptoms may appear in 2 to 14 days. Again, the CDC has just come out with guidance that is actually lowering that window and requiring people only to continue checking or quarantine or basically be worried for 10 days. So you're still going to have the 14-day window in Virginia throughout the 6 months that these standards are in effect, but the science is continuing to evolve. Next slide, please.
We had 2 questions that came in around this. Number one, what about people who have allergies? This person was saying that he displays symptoms regularly living in Virginia, and allergies can be kind of a problem, especially this time of year. So do they have to be reported if they are not out of the ordinary?
No.
Okay.
And that's a great example, especially in Virginia. Allergies are tough.
Yeah. And then the second question was, does this increase the exposure to an employer to employment practices liability claim?
Yes. I think that's why there's been the huge push for liability protection in the next Relief Act bill, because employers are very, very worried. You know, it's the risk of, do you bring people back or not? Do you reopen or not? But so long as there's no effective vaccine, there's no way for us to provide any sort of regular reassurance that the workplace environment is safe, as we would usually feel like we could reassure folks. And so I personally think, and there's lots of disagreement about this, I personally think that COVID claims probably will end up being treated as workers' comp claims if you can show where an employee gets COVID. And that's just so hard. I think unless you have a cluster in your office, that's going to be very difficult. But there are clusters in offices. And I mean, if you look at what's happened in nursing homes, right? When it gets into a place, it's hard to manage. And that's different. That's a living environment and not a working environment. So it very much depends on
the nature of the work people are performing, how many hours a day they are working together, how closely they are working together, all of those things. And there's always going to be lots of arguments with any virus as to where did you get it. But that's where I see the bigger risk for employers. It's not, oh, well, you reopened, or oh, you let people come back to work, or made people come back to work. It's, there was, you were notified of COVID and you failed to notify people adequately, you failed to clean adequately, you failed to remove people from the office adequately, and then 10 more people got sick. So, you know, in some ways, there's lots of great reasons for complying with this standard, but that's one of them, which is it should reduce liability to the extent you can show great compliance, and hopefully reduce the virus. Again, these are more definitions of things you can be asked to do. Obviously, they have to be technically feasible. I think this actually comes at it from the perspective of employees maybe asking you to implement measures either that don't exist or not possible technically. Again, the Department of Labor and Industry has made clear they're going to look at what your cohorts are doing, what are others in the industry doing. And a work practice control is another type of safety measure that employers need to adopt to keep people safe. Next slide. Okay, that's all the definitions. That's as far as we've gotten. Section 40 of this standard is applicable again to all employers. So if you have one employee and they're low risk, you still need to go through this checklist and make sure you've done all these things. The first one is, again, assess your workplace. Put everyone on a list and categorize them very high, medium, or low risk. Second thing, encourage and inform your employees that they must self-monitor for signs and symptoms. Self-monitoring doesn't mean that you have to collect it from them. Self-monitoring means they understand that they are required to do it, and they shouldn't be in the office if they have signs or symptoms beyond something like allergies, right? Which is not a sign or a symptom of COVID. It is an entirely different issue. Next slide, please. Here's the exclusion for antibodies. Doesn't matter. If somebody comes to you and says, I can come back to work, I've had an antibody test, the answer is, we can't consider it. Next slide. Develop policies and procedures, and you've probably done all this already, but having them in a format that you would be prepared to show to Bosch if they knocked on your door and said, we have a complaint, that lets employees know how to report if they do have signs or symptoms of COVID. The policy may just be you call HR or you call the CEO. It doesn't have to be an elaborate policy, but they need to know what the policy is if they are experiencing symptoms. And you have to tell them also if they're experiencing symptoms, they cannot come into work. They can't go to a client site. They can't come to your site. They need to be home. And that needs to be documented in one of your policies or procedures and communicated to employees. Next slide. If an employee has a sign or a symptom or even test positive and they feel perfectly fine, as an employer, you cannot prohibit them from engaging in telework if their job is amenable to telework, right? Like that totally depends on the nature of the job. But if they've been working from home anyway and they test positive unexpectedly, your answer is not, okay, well, now you have to go for 14 days without pay, right? You would want to continue to allow them to work. And this regulation sort of is protective for employees in that way. You also, and this is a quirky requirement, but you have to have sick leave policies that are flexible and consistent with public health guidance, and make sure that your employees are aware of these policies. The squirrely thing about this is the Department of Labor and Industry is a broad agency, right? But these are occupational and health focused requirements. They're not wage requirements. And so this doesn't create any requirement that didn't already exist. For example, that you have a sick leave policy or that you provide a certain amount of sick leave. I don't really think, the only requirement that I think actually comes from this is that you couldn't, for example, discriminate or treat worse or punish people who end up having or being known or suspected with a virus. But otherwise, the current policy that you have for sick leave is going to be fine. Okay, next slide. You have to discuss with any subcontractors or companies that provide you contract or temporary employees that you will not allow people who are known or suspected to be infected in the workplace. You cannot allow, if one of them does come into the workplace, basically you need to send them home, and subcontractors have that same responsibility. So they're really trying to make sure they've covered the whole employment chain here in terms of no one who's sick or who's suspected to be sick can be in the workplace. Next slide. You have to be able to receive, you have to basically set up a policy or process again so that employees know who to tell and how to communicate that they have tested positive. And if an employer receives that information, you learn that an employee has tested positive. Within 14 days of that knowledge, they have to tell their own employees. So if the employee tested positive 10 days ago, you as the employer have to tell, and you just learned of it, you have to tell your employees within 24 hours that there has been an employee, you can't share the name, but there has been an employee in the workplace who has tested positive. The regulation references HIPAA. It has nothing to do with HIPAA. It has to do with the Americans with Disabilities Act, actually. And that law has always required since 1990 that employers keep medical information confidential. So the reality is, in a small workplace and with this virus, my experience has been most employers have employees who pretty quickly figure it out. And that's okay. I mean, that's reality. It's still the employer's job not to be disclosing confidential medical information. You can, and I've worked with many employers who have done this too, you can ask an employee, are you comfortable with me sharing this information? Because some employees will be talking about it themselves. It'll be all over Facebook, they'll have called their friends, they'll have told their boss. And if the employee is comfortable with the information being shared, then it's fine to share it. But if they don't give you that permission, you need to keep the identity of the person confidential while disclosing to anyone who may have been exposed in the break room, in the elevator, in the office next door, that there has been a positive test. Next slide. Also have to let the building or facility owner know. Again, so cleaning can occur. Now the Virginia Department of Health has to be notified. Before, the physician or the entity that was doing the test would have notified the Department of Health anyway. I guess this just gives a dual notice to the Department of Health with the employer letting them know as well as the physician. And if you have 3 or more positive employees within a 14-day period, and only if you have at least 3, then you also have to notify the Department of Labor and Industry. They're worried about these clusters and trying to help folks manage when they have sort of an outbreak situation. Next slide. You do have to provide employees access to their medical information that they share with you as an employer. That's a VOSH regulation. So any COVID information would be the same. If they needed it for some reason, you would have to give it to them. They already gave it to you, but you'd have to give it back to them. In terms of returning to work, you have to have a policy or procedure that explicitly says you're going to either let people come back to work based on a symptom-based strategy or a test-based strategy. You can choose either one. The downside of the test-based strategy is that you have to pay for the test if there is any cost incurred. And I will say there's a lot of a lot of insurers currently at least, who are covering with no deductibles or other payments from covered folks COVID tests. So it could be that you implement this testing strategy and there's still no cost to you because your employer provided insurance plan will cover the cost. But if there is a cost, the employer has to pick it up. So think about that when you're deciding if you're going to let people back based on symptoms or tests. Next slide. There's more detail about the symptom versus test-based strategies. For symptoms, you have to have an employee who has been well for at least 3 days or 72 hours. And it has to also have been at least 10 days since their symptoms first appeared. Test-based strategy is they're well, they don't have a fever, they have improved respiratory symptoms, and they have at least 2 consecutive negative tests that are more than 24 hours apart. So the problem with testing also is just how slow and backlogged it's gotten. I have heard encouraging things recently that it's gotten a little better. And there was that press announcement that Virginia is getting like 500,000 instant tests through this coalition of 6 states. So testing may get dramatically better soon, which would be great. But that would be another, to the extent it's still slow in your area, it's going to hold people out of work maybe for no reason if you're just waiting on a test to come back. Next slide. If an employee refuses to be tested, then you can revert to the symptom-based strategy, even if your policy is to use a test-based strategy. And again, you can't require them to pay for the testing. Next slide. You also have to have a policy and procedure that specifically says what will you do about asymptomatic employees, people who never had any symptoms returning to work. They also need to use either a test-based or time-based strategy. Again, thankfully, the regulations say you can rely on healthcare professionals in terms of how to handle this. Next slide. Physical distancing, as we've talked about, is important both while people are doing their job and still on your property on paid breaks or during lunch. I think a lot of us have already, if you've gone back into the workplace, little signs on the floor or on the door or other cues that remind people 6 feet, stay 6 feet away. Reducing, for example, how many people can be in the conference room, how many people can be in your workroom, physically removing chairs, making it impossible basically for people to be sitting as close as they used to sit pre-COVID is what the department is going to be looking for if they get a complaint and they're investigating. Next slide. Again, this emphasizes that the same distancing requirements apply in common areas, break rooms, lunch rooms. You cannot have them as they were before. You need to either close them all together, which would be inconvenient for people, or control how many people can be in there. Next slide. Some examples of how you would space. We all see this anytime we walk into a restaurant or any other physical space anymore. Have to have freely available hand washing and hand sanitizing, have to have cleaning and disinfecting supplies, and clearly post on the door how many people can be in any room, how many people can use this conference space at one time, so that employees, not only is it in your handbook or on your website somewhere, but when they walk into the space, see it, know it, easily can comply with it. Next slide. Have to clean and disinfect, don't infect, areas that are used after using them and at least once a day. So having cleaning supplies available in each common space is really important. And again, they were very concerned about multiple people occupying a vehicle. I don't know how often that happens for y'all, but masks would have to be utilized in the vehicle at all times for anyone who's sharing a vehicle space and traveling together for work. Next slide. Face covering. I feel like we've talked about that. Next slide. More. Oh, there are folks who both for medical reasons and religious reasons seek a waiver. If they are seeking a waiver from required face mask use in your office, they actually go to the Department of Labor and Industry to seek that waiver. That's not something that you as the employer would have to handle. So I thought that was helpful that the regulations made that clear. You can be fully supportive of it. The truth is, though, they're not going to let someone create a risk to everyone else in the workplace. So it'll be interesting to see how they handle those requests while respecting people's religious and medical needs and situation. Next slide. Sanitizing and disinfecting, as you would expect, right? All common spaces frequently touch doors and surfaces.
any shared tools, workspaces, or equipment. All of that has to be cleaned. There's also a heightened requirement, is exactly as you would expect, which is that if you do have an employee who is known or suspected to be infected, their specific workspace has to be cleaned and disinfected before anyone else is allowed back in that area. And ideally, the Department of Labor and Industry would like that area not to be used for 24 hours. That's a where feasible standard, not a hard rule, but good to keep in mind. Next slide. Okay, so I've taken up the whole hour. We've gone over all the requirements that are applicable to every type of employer. And I didn't even include these because you're not going to be in the very high or high categories. Is a good deal more information in the slides about the few additional medium risk requirements where you all might be. And a lot on the infectious disease response plan, which you probably don't need to prepare, but there's the template if you do, and the training requirements, which we covered. So we really got through most of it. I'm glad to answer any questions either now or separately in a follow-up, and of course to be sure that you all have the templates. Carter will help me confirm that as well. Any other questions, Carter? For now?
I don't have any at the moment. Oh, just kidding. What level of enforcement do you expect? That just came in.
So I think when Vosh gets complaints, they were very, very active in the beginning of the outbreak, particularly with PPE and healthcare providers. And there was such a shortage. It was this impossible storm. There's not a shortage anymore. So I would say it depends very much on your workplace. But if you have employees who are concerned and feel unsafe and don't feel like the policies are adequate to keep them safe, or they're not being provided hand washing, hand sanitizer, masks, distance, I think Bosch is going to take this very seriously, and it's very expensive. A single violation is a minimum of $13,000. And so you can imagine you could have 5 or 10 violations and already be sort of at a staggering level of cost. Very much want to be able to show you tried in good faith to comply with all of these standards. I think they'll give people a break in the very, first couple as the news trickles out, and then I think they're going to be like a hammer. I think they want employers to do everything they can.
I did have one question that was specific to IIAV. So it was about whether the recording will be available to view later. We will be sending this out to all of you who are registered, and we will be getting it out to you just as quickly as we can. So yes, you will have access to the link. It will be housed on our website with all of our other IIAV Connects. So if you have any interest or you've missed one, you can go back and check those out as well. And also you are certainly more than welcome to share that with anybody that you feel could benefit from this. Kim, question for you. Do you think it will be primarily in response to employee complaints? I think this is in regard to enforcements versus the VOSH inspections.
I do. I don't think they possibly have enough resources to be doing sort of random audits. I think it will be almost entirely complaint driven. And they do have, I'm always suspicious of this. It's because I'm a lawyer and I fight with them all day long. But they do have a free consulting service. So if you're brave and you want to invite them in, they would be glad to come and provide advice. And that's terrific so long as you're willing to wholeheartedly embrace everything that they tell you to do. And many employers would be. I'm personally not inviting them in, but it's an option.
And then the question was, did you say the temporary order is in place for 6 months?
It is in place for 6 months unless something crazy happens, like there's no more emergency, everything's better. Or they could even adopt the permanent standards sooner, but there is going to be a lot of push and pull on that. There's a lot of employers that were imposed even to the temporary standard. So I think it will probably be in place for 6 months and then we'll see. I mean, if we're lucky, things are better and it goes away. If we're not, we probably have some version of the permanent standard. You can see though, it's completely COVID focused. So if we fix COVID in 9 months, even if it's a permanent standard, it won't really affect anyone.
It's 2:04, so I want to be respectful of everyone's time. I know we probably could continue this conversation all day. It's a pretty meaty topic. So, Kim, thank you. Thank you. Thank
Oh,
you.
thank you.
This is not only a really complex topic, but one that talking about pivoting, you've had to learn it all really quickly. And so thank you for being with us today and trying to unmuddy the waters for us a bit. We really appreciate it. Thank you to each of our attendees for joining us. As I mentioned in the beginning of this conversation, we are absolutely committed to walking with you every step of the way. And these conversations will not end as things reopen and as we soon, hopefully, put this all behind us. It is our fervent hope that IIAV Connects will continue to be a part of your week and your month. And we welcome your input as to how we can offer what is most meaningful to you. We will continue to offer these conversations every other week throughout the summer. We really want you to be able to get outside and enjoy a little time out of the house, maybe a socially distant vacation if you can. But we hope that you will join us 2 weeks from today for our next conversation on August 19th. And for that conversation, we will be joined by Greg DiDio. He is the CEO of Kite Technology. The ability of your team to be able to pull together and make really big things happen is critical, especially right now. But with the level of uncertainty and the constant change that we're all experiencing, not to mention, in many cases, the physical distance that is created by remote work or even just social distancing within the office, it's all very likely to have an impact on your organizational culture. Greg is someone who is very passionate about organizational culture, and he and his team have built a truly incredible culture at Kite Technology. This conversation is one where he is going to share his top recommendations for a strong, thriving culture, regardless of the circumstance. He'll also be spending time talking about how this season that we're in has likely impacted your culture to some degree. He will be providing strategies for maintaining a strong culture, or how to adapt your culture when it's necessary, or even how to breathe life into your organization and create a stronger culture than you currently have. So regardless of what your situation is, this is a conversation you are not going to want to miss. It is going to be packed full of information. It's also going to be really fun, I think. And I suspect that it's going to be another one that will lead you to be taking a lot of notes. So we will be sending the link to register along with today's recording, along with the links that we referred to in this conversation, as well as any other resources like the PowerPoint that Kim has been sharing with us today. So look for that email following today's conversation, and we encourage you to join us. But in the meantime, we hope that you remain safe and healthy and that you enjoy this summer weather we're having. And thank you so much for inviting us to be a part of your week. We'll see you back here on August 19th. Be safe, everyone.
Thank you.